what's housed in your gallbladder. And so if there's a backup of your bile, if it's not able to leave your gallbladder and be excreted into the small intestine, you can see your bilirubin levels increase. And if they increase high enough, then the dog will look visibly jaundiced. And in people, especially in pediatrics, like they can gauge your level of jaundice based on where the yellowness appears. We're not, that I'm aware of, able to do that in veterinary medicine. So when my son was born, a few days later, he became jaundiced. And what was interesting was when I took him to the pediatrician, she said, you know, we checked his bilirubin levels, but she said she doubted he was that jaundiced just because the yellowness stopped like mid-abdomen. And I don't know if we just haven't studied that in animals or that's just not how it works in animals. My guess is it's probably both. I think the fur inhibits us from seeing the jaundice as clearly, because a lot of times you look like in the inside of the ear flaps, the whites of the eyes. If it's really bad, the gum color. Sometimes the thin-haired regions, like in the armpits, also called the axilla, or in the inguinal area or the groin area, sometimes you can see it. But as far as I'm aware, there's no known correlation between location of jaundice and severity of jaundice, except the worse the jaundice, the more yellow they are. So if the pancreas swells enough, it can reduce bile flow from the gallbladder and potentially even obstruct it. That is very uncommon, but in rare instances, you do see complete obstruction of the bile duct, and those do actually end up becoming surgical cases because you have to create an outlet for that bile to flow. Otherwise, that can potentially be fatal. So acute pancreatitis in dogs, we said fever, they really don't feel good. They're lethargic, they don't eat, they vomit, they may have diarrhea. Cats with acute pancreatitis, usually they stop eating. Like that's the primary sign you see in cats. They sometimes have a fever, they sometimes have abdominal pain. And the abdominal pain isn't usually something that owners can tell. It's usually when they come to the clinic and I try and feel their belly and they meow, or they give me that look like, do it again, lady, I dare you. And they can sometimes have elevations in their white blood cell count. And that, in part, in both dogs and cats is dependent if there's an infectious component, because as a general rule, pancreatitis does not have an infectious component, but severe acute pancreatitis and severe chronic pancreatitis can. For chronic pancreatitis, dogs can usually get like this, we call it waxing and waning. So they're fine, then all of a sudden they get vomiting and diarrhea and lethargy and a fever, then they're fine, then they get vomiting, diarrhea, lethargy, and a fever. And in cats, frequently, the initial episodes of pancreatitis were not recognized by clients. So mom and dad don't notice that, hey, Fluffy stopped eating for a couple of days, because then all of a sudden they're fine. You know, you say, hey, I haven't really had to fill that food bowl as much, but then by the time you realize it, they're eating again. And a lot of times that's the history that you'll get is, yeah, if I think about it over the last 6 months, periodically we're not eating as well, or we may have intermittent soft stool, or I may find a vomit here and there. And it isn't until they get fairly sick that they're brought to the clinic. And at that point, it's kind of sometimes hard to tell, like, do they have chronic pancreatitis or do they have acute pancreatitis? And one of the things we need to kind of keep in the back of our mind is, okay, so pancreatitis is a big deal because it makes them vomit, it makes them not feel well, they have diarrhea. No one wants their animal to have diarrhea. But your inflammation of the pancreas can cause a lot of other potentially serious complications in the rest of the body. And those include affecting the way they breathe and also affecting the fat stores throughout the body. And in really severe cases, it can cause what's called DIC, or disseminated intravascular coagulation. And in DIC, what happens is that you basically have at the same time massive bleeding within the body and clotting. And the reason all of these weird things can happen is because in addition to those enzymes, your pancreas secretes other factors that cause inflammation throughout your body. So it's almost like your pancreas acts as like this warning signal to the rest of your body. Hey, there's something really important going on. I need you to respond. And it can cause just system-wide inflammation. And in super rare, and I've never seen this, but in super rare cases, it can actually cause pancreatic encephalopathy or brain damage, like inflammation of the brain secondary to the pancreas. I have seen DIC, or disseminated intravascular coagulation, secondary to pancreatitis Unfortunately, when that occurs, it's usually fatal. But I have only seen that twice, and oddly enough, during my internship. And those were just really severe pancreatic cases in dogs. And despite really aggressive care in the hospital for multiple days, they didn't make it through. Most pancreatitis cases are what we call uncomplicated. So they resolve with fairly easy supportive treatment, and they don't necessarily require hospitalization. But if you can't get the vomiting under control, if you can't get the dehydration under control, or if you're worried about system-wide inflammation, they really do have to be hospitalized. So the way we diagnose it is we used to rely in part on two enzymes that are found circulating normally throughout the body called the amylase and lipase. The problem is that those values are not pancreatic specific, so they can go up with GI inflammation, they can go up with other causes of inflammation in the body, and so they're not super reliable. If you have a dog that has a fever, abdominal pain, high white blood cell count, and has an elevated amylase and lipase, you probably have pancreatitis, but there's better tests we can run to confirm that. In cats, amylase and lipase is even less reliable. So to definitively diagnose it, there's a couple of methods we can use. One is there's an in-house test called a SNAP CPL or FPL, which is canine-specific pancreatic lipase or feline-specific pancreatic lipase. And that basically, you take a couple drops of blood, you put it in this little oblong case, and then when it sucks up enough, you snap it, and then you wait, I think 8-10 minutes, and it's a positive or a negative. And so it is either, yes, you have high levels of this enzyme, or no, you don't. And there's some gray zone, like you have really strong abnormal or a weak abnormal. The problem I've run into with that test is it is not as sensitive. So you can have, it's not as specific. So you can have false positives. So even if you don't have pancreatitis, you can still have an abnormal reading because you have inflammation within the small intestine. So there is what's called a SPEC CPL and SPEC FPL, which you send off to the lab, and that gives you a quantitative value, so an actual number. So that tells you how much of that enzyme is present in the body. And it does take overnight because you have to send it to the lab and you don't get it back till the next day. But that, to me, is much more helpful in determining if I have pancreatitis. And it also gives me a value that I can monitor. So if that value comes back abnormal, as we treat, we like to recheck it to make sure that it's coming down. Because if it's not, if it's always abnormal, then we need to be a little more kind of strict in how we treat it, and we have a better idea of chronic pancreatitis. There are other testings you can do, such as an ultrasound. So we do not have ultrasound ability at my hospital, but we have a traveling ultrasonographer, and we also have referral areas that we can send them. And ultrasonography, I believe in I think the last estimate I saw was 68 to 70% definitive diagnosis with ultrasound. And when the pancreas is inflamed, it looks different on ultrasound than if it's not inflamed. But it doesn't necessarily mean that it's an active inflammation that's causing the current signs. There is an unofficial, it was never actually an official study, but again, going back to my internship, I was told by an internist once that if you look at an x-ray of an animal when they're laying on their back and they have pancreatitis, you will be able to visualize the right kidney more easily than if they don't have pancreatitis. And the reason for that is when the pancreas gets inflamed, the fat that's around it gets inflamed, and fat increases your ability to see detail on x-rays. And so if there is more prominent fat or inflamed fat, it will allow you to see things better. And so if I have an animal that has signs that are suspicious for pancreatitis, and I can see that right kidney on what's called a VD or a ventrodorsal view, or when they're laying on their back, then it just kind of makes me think even more, okay, I bet this dog or cat has pancreatitis. It doesn't mean I don't run the other tests, but it's just I can have those results back almost immediately, whereas the other testing would take longer. So, we have a patient that comes in, they're sick, we run their baseline blood work. We can look at their amylase and lipase with a grain of salt. We look at their liver enzymes to make sure there's no concurrent inflammation in the liver. We look at their white cells to ensure that do they have what's called a systemic inflammatory response? Do they have high white cells? And then we need to treat them. So if they're not really dehydrated or mildly dehydrated, if the vomiting is not severe, if the diarrhea is not severe, then we can treat them as what's called an outpatient. So we usually treat with fluids under the skin. We give an injection of an anti-nausea medication. The most commonly used one is something called Cerenia, which lasts for 24 hours. The nice thing about Cerenia is that it stops vomiting two ways. It reduces the stimulation of the vomit center in the brain, and it also reduces signals from the intestines themselves causing vomiting. And it reduces something called substance P. Substance P is a factor that's involved in inflammation, and by suppressing substance P, you help relieve inflammation. It also helps with GI discomfort and cramping. And if you've ever had the stomach flu, like one of the reasons that you really get incapacitated is that just severe intestinal cramping. And that can really help. And so, we give them fluids, Cerenia. Sometimes we can give them injectable famotidine or Pepcid. Some clinics will have injectable Prilosec or another proton pump inhibitor. And then I will often give them B12 injections as well. Now, if I am worried about like long-term inflammatory bowel disease or true B12 deficiency, then I want to draw blood to test for that first. But you can give a single injection of B12, and even if they don't have truly low B12, it usually makes them feel better. It gives them a little more energy. But part of what your pancreas does is it helps your body absorb B12. And so if your pancreas, especially chronic pancreatitis, has not been functioning as well, you're not going to absorb B12 as well, and you're not going to feel well. It can lead to anemia. It can lead to a lot of complicating issues. So just giving them some B12 often makes them feel better. Other things I incorporate as an integrative veterinarian are acupuncture can be very helpful. Aquapuncture, which is I take B12 and I inject it in acupuncture points. The nice thing is if they don't feel well and they really don't want to sit for acupuncture, I can give them the B12, which I was going to give anyway, in certain acupuncture points to help relieve nausea, help relieve stomach cramping. And then they usually go home on medications to help with the diarrhea, more oral anti-nausea medications, probiotics because we want to help repopulate the gut with good healthy gut bacteria. That also helps to reduce inflammation, and about 60% of your immune system's in your gut. So if you keep that happy and healthy, you help the rest of your immune system. And then they'll usually go home, at least initially, on a low-fat diet. We used to fast these guys thinking that if you reduced the pancreas's exposure to food, it helped. But what they're actually finding is that the introduction of food faster is better. I mean, you don't feed them a whole bunch really quickly, but the sooner you can get them eating, the better for them. But you want to reduce the amount of fat that they're exposed to. And in acute pancreatic cases, that is a transient thing, right? So we change the diet, usually to a prescription like Hill's Science Diet, Purina, and New Canin all have prescription low-fat diets, or you can make a homemade low-fat diet. Long term, if it's a chronic pancreatitis and we need to change the diet completely, you have the option of using those prescription diets. There's also an over-the-counter low-fat diet called Anamet Lean that I really like. That usually dogs find fairly palatable. But you want, ideally, long-term, if you need to reduce the fat, to it be 7% or less as far as the diet's concerned. So those are the kind of mainstays of treatment. For my chronic pancreatitis cases, I will frequently use Chinese herbal therapy as well because it does help reduce inflammation and help calm down the pancreatic irritation and that cycle of waxing and waning. But those are kind of the mainstays of treatment. Cats, you treat them pretty much the same. If you are really suspicious that there's an infectious component, you can also treat them with antibiotics. Most of these guys, I don't need to. That being said, the most common, what we call quote-unquote anti-diarrheal medication, metronidazole, it's actually an antibiotic for the gut, so it kills off what are called anaerobic or non-oxygen loving bacteria in particular, and it also reduces inflammation in the gut. So in theory, yes, I do use antibiotics more than I say that I do, but they're not, antibiotics in the sense that I'm treating it specifically because I think there's infection within the pancreas. But if I do worry about infection within the pancreas, there are certain medications that I'll use depending on the spectrum of coverage I need. Or in cats, realistically, it's palatability, because the last thing you want is to say, oh, your cat's not eating and vomiting.